Good afternoon. We're here because we have an intense interest in making sure that every American is covered when they have any kind of a health crisis. And we've been working on this for some time, actually several years. I sat down and worked with Senator Kennedy on some principles that we could work on. Then I gathered ideas from both sides of the aisle and came up with a 10-step plan that's on my website. Now we're down to a point where we're actually drafting and moving beyond that on bills. And I do want to say that you cannot have a bipartisan bill unless Republicans are involved in the drafting. If the plan is shoved on you from the other side, and then they just try and split off one or two people, that's not bipartisan. If we're going to have a plan that America believes in, what we need to have is 75 or 80 senators backing that vote. That will be an indication that we've looked at all the unintended consequences, we've looked at the loopholes, we've looked how we can take care of everyone. That will provide more perspective on the problem and the solutions. Of course, I'm hoping that we start with the problem and work to the solutions, as opposed to starting with solutions and trying to find a problem that fits them. And I've seen that happening in some of the things that we've been working on. This will be the most sweeping legislation that Congress has ever done. This will affect 100% of the people in the United States. This will affect 100% of the companies, it'll affect 100% of the providers, and it'll affect 100% of the consumers. That's pretty consuming legislation. And we need to be sure that we get it right, or we will cause a tragedy in America. I'm a little concerned about the speed of the schedule. We're more concerned in meeting the deadlines than we are in meeting the principles that we need to have to make sure that we're taking care of everyone. I'm also a little concerned about some intimidation that I'm hearing about. It's my understanding that some of the groups that are stakeholders, and I like to talk to all of the stakeholders that I possibly can to see what they see in the way of loopholes and unintended consequences and getting it right. But I'm hearing that they're being told that if they meet with Republicans, that it'll be considered a hostile event. I don't see how that fits in with health care. I don't see how that fits in with us getting enough information to know exactly what we're doing and how our ideas are perceived by the people that it'll make a difference to. We do have a lot of concern about a government-run plan. We're worried about a Washington bureaucrat standing between you and your doctor. It would violate a pledge that we've heard from the president, one that he said that if you like the health care you have, you can keep it. I've seen some of the language which says you can keep it unless there's a slight change made in your plan, and then you don't have it anymore. You'll have to go with whatever has been arranged. That won't work. Republicans are putting forward ideas to cut down on costs, to help low-income families pay for health insurance, to promote competition and choice, to make sure that all Americans have access to quality, affordable care. So Democrats need to be working with us on these ideas. I've had some hope in the last couple of days in the walkthrough that we've been having, but again, it's on a very tight schedule, and that schedule has to be able to accommodate the real discussion of real ideas. And that's the only way that we're going to have a bipartisan bill. The draft that was put out didn't include any of the Republican ideas. We have been able to force some of those options into the discussion. And hopefully we'll get some of those put into the bill before we have to actually mark it up. A markup can be a very intimidating and a very one-sided thing, and it shouldn't be on something this encompassing. We want to get it right. We want it to be bipartisan, but we don't want the bipartisan definition to be a Democrat bill that has 2 or 3 senators from the Republican side on it. We want ideas included. There are a lot of ideas out there. There are 4 plans already on the Republican side, and then there's one very joint one between that Wyden and Bennett have been working on, and all of those ideas need to be considered if we're going to have the best kind of health care.